अस्सलाम वालेकुम नाज़रीन, देसी टीवी यूएसए में खुशामदीद। एआई की बुनियाद पर सेहत की इंश्योरेंस के दावे क्यों रद्द हो रहे हैं? जैसे जैसे टेक्नोलॉजी बढ़ रही है, बहुत से लोगों को खुदकार निज़ाम के ज़रिए इनकार का सामना करना पड़ रहा है। एथनिक मीडिया सर्विसेज के ताउन से हम इस मसले के असरात जानेंगे, तो चले शुरू करते हैं।
One of the things that make our system so difficult is that we have many different regulatory components in health insurance. So depending on where you get your insurance, you may be regulated by the state, but for many people, for half of people, they're in employer insurance and ERISA plans, and those are very loosely regulated by the Department of Labor. But really, there you're kind of appealing to your employer in a way, because the employer's really paying the bills at the end of the day. And then CMS is regulating Medicare. So one of the things that drives, I think, a lot of frustration and is the complexity and the fact that there isn't a single regulatory entity. And in some states like California, there's I think that there can be a very pro-consumer bent to state regulation, but in other states, not so much.
The accusations and what's been reported highlight the inherent limitations of algorithms, which lack the capacity to make the nuanced individual decisions that only trained physicians can make. That's why I worked with the California Medical Association and with doctors to develop this bill, appropriately called Physicians Make Decisions. We need the human element, and this bill responds to concerns by ensuring that healthcare decisions prioritize patient well-being over automated processes. At its core, it requires a licensed physician oversee decisions made by AI algorithms in health insurance processes, such as claims processing and prior authorization requests. We hope that this simple and yet powerful safeguard addresses a critical gap in the current system by ensuring that human expertise is integrated into decisions about patient care. We've already had other states contact us, and actually now the federal government, some members of Congress as well, reach out. We're hoping that this is another example where people will follow California's lead.
I talked with a lot of physicians in the course of my research, and there's a lot of frustration about prior authorization because of it feeling as though insurance companies are essentially practicing medicine without a license, because it's a barrier between what they as clinicians believe their patient needs based on their comprehensive understanding of their patient and what the patient is actually going to be able to access. Now, and then that doesn't even take into account the fact their peer-to-peer reviews of denied prior auths are often with people from completely different specialties. And so this creates other levels of mistrust and distrust in the system. What I've personally advocated for in my own work is having audits of overprescribers and random audits of physician prescribing essentially on the back end, rather than imposing these front end barriers to care, which are cumbersome for both patients and physicians.
नाज़रीन, अगर आपको ये वीडियो अच्छी लगी हो तो बराए करम इसे लाइक करें, हमारे चैनल को करें सब्सक्राइब और कमेंट्स में अपनी राय बताएं। याद रखें, आपकी राय अहम है और हम एक साथ मिलकर इन मसाइल का सामना कर सकते हैं। खुश रहें और बाखबर रहें।